And a lot of key lawmakers are saying this is going to be tough when it comes to re-election for some people.
Of course, we just heard what our Democratic Representative Susan Davis said she's going to do. Brian Bilbray, our GOP congressman, is going to vote no on this, we assume. Certainly he's said that. He's on the phone with us live this morning. Representative, thanks for joining us. What's going on now on Capitol Hill?
Well, what's actually happening is there's a demonstration for amnesty being rallying outside of the Capitol right now, and that has turned into a amnesty slash federal health care system kind of rally. So that's one of those issues where they're now realizing that this bill that the Senate has says that everybody in the United States must pay a tax for health care, except if you're an illegal. But if you're illegal, you can get into the system because nobody will check. There's no verifications, no checks to make sure you're legal in the country. So we not only create a situation now where for an American to live in the United States, they have to buy something or pay a tax, but a foreign national who's illegal is exempted from that tax but still has access into the system.
In your perspective, Congressman Bilbray, and a lot of Republicans are saying Democrats will pay dearly in the fall if this passes. Why do you think there'll be a backlash after this health care bill, if it does passes?
Look, Bridget, you and I know that the Republicans were rightfully punished last election for not listening to the people and for all of the backroom shenanigans. And this bill, when you come out, it's got special deals for Nebraska. It's got what's called Gatorade. You've got what they call Louisiana Purchase. There's all these backroom deals. And
doesn't the reconciliation fix that, though?
Well, not if the senators don't approve with it.
Well, that's the key, isn't it? This still does have to go back to the Senate.
And we're going to be voting on a bill. We're going to be asked to vote on a bill in the House that has all those deals in it. And so we'll be voting for those backroom deals if we vote for this thing. And that's the one they'll say, oh, don't worry, we'll correct it. You know, yeah, once you pass the bill, what's the incentive for the senators to sit there and tear their deals apart? There isn't any.
So are you saying there's no trust on Capitol Hill?
Well, I'll tell you that I wouldn't have any trust between the House and the Senate. But, you know, Dan, the one thing to remember, this isn't like having the city council or the state do it. You know, one thing I don't like about the Republicans, they keep talking about government takeover. No, this is federal government control, which means whenever it goes to Washington, it doesn't take 5 votes to reverse it. If, you know, if the mayor makes a mistake, he can go over and the city council can reverse it the next day. Back here, it takes a generation to reverse this type of legislation, and that's the one that really bugs me. As a former mayor, these guys in Washington say, oh, don't worry, we'll take care of it later. How many times have we heard that? I mean, we went 50 years with welfare continuing to, you know, pay drug dealers. So this thing has got a whole lot of things that we should be sitting down and talking about. But for the House to be approving the Senate bill, which is full of pork, full of earmarks, full of backroom deals, and then say, oh, don't worry, we'll correct it later. I think the American people are a lot more sophisticated than the Washington crowd gives them credit for.
And I know that the Republicans say that this bill is it's too much. It's too much to spend right now. But what do you say to those people who are spending so much on their health care now, and they're watching their premiums go up, and a lot of them are frustrated with the system, and that's why there is outcry on the other end?
Well, and there is, and that's why last week, Republicans and Democrats pulled together and eliminated the antitrust protection for these insurance companies. That's why we should stop states from telling you, Sandra, you can't buy insurance from another state. You got to stick with only the buddies that we've cut deals with. That's why we need to talk about tort reform. How do you talk about affordable health care and not talk about the $54 billion a year that it goes to lawyers rather than to medical coverage? I mean, there's a lot of things we can do there, but you don't have to promise the world and don't have to have the federal government take over everything as a way to address these issues.
There is so much passion in this issue, and all of that is coming to a head in Washington today. Congressman Bilbray, thanks for joining us this morning. We'll check back in later.
Absolutely. Thank you very much.